This is Sonia. She is our brave demo patient today. All right, Miss Sonia and I chatted about a week or two ago, and we talked about some things that were bothering her that she did not want happening on her pretty face anymore. So, you already put it on? Okay, so I'm a clean freak, so I have to wipe her off even though my nurses have already done it. So Sonia wanted a little bit of lifting of her cheek because she's noticing a little tiny bit of the jowling starting here that she really is not liking. When she smiles, smile for everybody. She really doesn't like the little bit of the crease that she's getting there. I'm going to start with her cheek because sometimes just lifting the cheek will actually minimize some of the lines here. So we're going to start with that and give her a little lift. She also is wanting just a little bit more fullness to her lips. She doesn't want Kardashian lips, which is great. I don't really like Kardashian lips personally. But so we're just going to give her a little bit of volume. And I'm actually going to start with her lips because she's nice and numb right now. And that's the part she's most nervous about. So we're going to start with that and get it over with really quickly, okay? Obella. So I love Obella. Yep. Shoot that champagne, girl. That always helps too. That always helps too. All right. So the Volbella is one of my favorite for people who really just want their lips to be a little fuller and a little more plump. Not really big, giant lips. So Sonia, just open slightly for me. And what we're going to do is we're just going to give her a little bit of volume back. It's going to be a little pinchy, okay? That's the main part. And there are certain there's anatomy of the lip that we just try to redefine. And it's these little pockets. They are almost like little pillows. And there's one on each side of the lower lip and there's 3 in the upper lip. So we just kind of redefine that area. How you doing, baby?
It's fine.
Not too bad?
No, it's not bad at all.
We actually transfer the Volbella into these little tiny insulin syringes too. So the needle is so tiny that it really doesn't hurt. Look at you, see? You're a rock star. So you can already see, that just gives her a nice smoothing and plumping of the lip. It almost makes the lip look hydrated. We start to feel like our lips look wrinkly. This actually just rehydrates. It actually pulls water into itself a little bit too, and it rehydrates the lip. So it just looks beautiful and natural. And not too terribly painful, right? Good. Now open one more time, because I'm going to do your upper lip. Just give you a little bit of fullness there. Beautiful. Coming in just a little bit more toward the middle. Do we have an ice pack? Because before I do the very middle, I'm going to ice you a little bit because that makes it a little bit nicer. Ice is nice.
Yeah.
Beautiful. Okay, I'm going to come around to this other side. And open one more time, baby. Give me one more Hiba cleanse, please. There's an extra. And open for me one more time. Really pretty. Okay, put a little ice right there for me. Right in the middle. Be nice to you, baby.
Warm it up real good.
Because the middle is the most painful spot. And open one more time. I'm just going to do that little middle. Put it up there. Yowzers. And last stick right here. Beautiful. So very pretty. Just rehydrates and kind of fills in the lips without making them look huge. Okay? So that's the beauty of that. That's going to be enough.
Good?
Yeah, we're good on that. I love it. Yeah, beautiful, baby. Very pretty. Okay, let's lift up. You really can see it immediately. See, that's the really cool thing about it. And the Volbella doesn't pull a ton of water. It maybe will hydrate a little bit or get a little bit swollen, but not bad, like a lot of the other products. So what you see, yeah, you'll be swollen a little bit today and tomorrow, but it's not going to be bad at all. Okay, so this is Voluma. This is a different type of filler. This filler, if you inject it onto like a little gauze, you actually see it'll pile on top of itself. It's structured so that it's made to lift. Okay, so when you do it, we need to put it on a firm surface. So this actually goes right down on the bone, and we do it in areas where we're trying to really kind of rebuild the scaffold and the structure of the skin. Okay. All right, so Sonia, put your chin down. Perfect, just like that. So what I like to do is put it here and try to lift this cheekbone back up, because this is what she's not liking. She feels like she's starting to get a little pooch there that almost makes her feel like she's getting a jowl. So I lift and get the cheek kind of where I want it, and then we go right in front of that point, and I go straight down, right on the bone. How are you, baby?
Perfect.
Beautiful. And that just sort of lifts that cheekbone right back up, and we're going to go right up laterally one more pinch. Stick. How are you?
Perfect.
Beautiful. Good. So that actually already is starting to kind of resuspend your cheek. This will continue to lift. Usually at about 3 to 4 weeks, I can see the very best of it, because actually collagen and things start to build around this filler, and it actually even lifts more. So usually I'll do my follow-ups at about 3 weeks and make sure everything looks perfect. Okay, great job, babe. Same story on this side. So this is Voluma. Volbella is what we did in the lip. This is Voluma. And it's the one that really restructures the cheek. I'm sorry, Sonia, it sounds creepy, doesn't it?
Yeah, it was the sound that got me.
Yeah, the sound will get you, because actually we're putting it truly on bone, and bone transmits sound. So you can hear it going in, so it's a little bit creepy. But not really painful, right?
The paint's not bad.
Beautiful. I love that. Okay. All right, now I'd like a little, champagne time, baby. All right, so the next thing we're going to do, when she smiles, she does have a little bit of deepening of her smile line. I don't like to completely eliminate smile lines. I think they're kind of pretty, and I think it looks weird if we don't have a difference between our cheek and our lip. I think we look strange. I feel like a lot of times people get overfilled, and they almost look too heavy in the middle of their face. So I don't like to overdo it. So we're going to do just a tiny little bit of filler there. The other place that I like to inject is this little area right here. It's called the piriform aperture. And we lose a ton of volume. We lose the support structure of the nasolabial fold right in that spot. So sometimes just filling that will almost correct an entire nasolabial fold. So we're going to start there. Will you ice her right there? Yep. Great. Thank you. All right, Sonia, this is going to be a little pinch. Okay. You're going to go right down here, also on the bone. Weird. You okay? Mm-hmm. Always pull back and make sure I don't get any blood vessels there. Don't want to inject it in a blood vessel. Great job. Yeah, so I don't know if you guys can appreciate that. It's pretty subtle. Lift your head up for me. Can you tell that just from that one little injection, that side looks a lot better? Just a tiny little bit of filler, and it looks beautiful there. And now we're going to go right in this little line that we don't love. That one's more fun. Beautiful. Okay, great. Do the other side, and then you're all perfect, girl. Yeah, we'll do some Botox too.
You have to get rid of my RBF.
She says she wants to get rid of her RBF, so we're going to get rid of her lines here, make her not frowny anymore. Chris will be so happy. He won't know that you're frustrated with him or anything. It'll be great. I'm sorry, that was weird. You okay? And then smile. Yeah, perfect. I know, that one's pinchy. All right, beautiful. So the next step is a little bit of Botox. I love it. All right, so smile at me big. So what we're going to do, face the crowd there for me. What we're going to do is we're going to try to help her get rid of these little fine lines that are starting here, and then frown at me. Pull that together. Yep. We're going to get rid of that guy too. Mm-hmm. Yep, and she's just going to look perfectly happy all the time. It's going to be beautiful. Yeah, we're going to put a lot in there, don't you worry about it. We said 15 minutes, didn't we?
And then we said more on my right side is more droopy. Remember?
Yeah, so in your forehead, we're going to do a little different. So I'm going to do these crow's feet and right here in the middle, and then I'm going to talk them through what we're doing on your forehead, okay?
You know what I think that's from?
What?
I had Bell's palsy on my right side.
Yep, that's exactly what did it.
And I think it has like slowly
just changed that side of your face a little bit.
So
She had Bell's palsy, she was saying. And so one side of her face, on her forehead especially, is not perfectly symmetric, and most of us aren't anyway, but we can correct that with Botox though. You doing okay? Mm-hmm. Bleed a little bit. Sonia, just hold that right there, sweetie, so that anyway for you.
Yep.
All right. Smiley smile. Beautiful. Frown at me. Perfect. Now relax. Beautiful. All right. Now, let's do your forehead. So put your chin down one more time. Raise your eyebrows really high. Now relax. So can y'all appreciate that her right eyebrow is a little bit lower than her left eyebrow? A little bit. So we're going to do a little bit less Botox on the side where she's lower, because we want that side to lift a little bit more than the other side, and that'll just even out and make it more symmetric for her. Okay, so raise again, sweet girl. Perfect. Now just relax. So I'm just doing 1.25 units there and there. And then we're going to do a little more on this side. Raise up again. Perfect. Let's go ahead and do 2.5 there. And 2.5 there. And then we're going to do just a touch right in the middle, and she's going to be all finished. Beautiful. Okay, you did it, baby. Yay. Excellent. Any questions for me? The thing, what I just did up here? Okay, in here we did Juvederm. It was Juvederm Ultra Plus. They're all three hyaluronic acid fillers. Hyaluronic acid is the substance in your skin that holds water and supports the collagen and elastic tissue, but they're all structured differently and cross-linked differently, okay? So this one is really made just to pop the skin and kind of support a line or a wrinkle, okay? Whereas the Voluma is made to actually lift and kind of push the skin up almost like a scaffolding, okay? And the Volbella is really just to smooth and hydrate the skin. So because of their different structure and their different cross-linking, we use the different products in different places. Does that make sense? Good question. How long they last? Yeah, so Voluma in the cheek can last in some cases up to 2 years. The Volbella, usually we're going to need to retouch that somewhere between 6 months and a year, depending on how quickly the person breaks it down. And then the Juvederm's at least a year. Yeah.
It's all good for you.
She's good. She's good. Now the Botox, most of us need to do that every 3 to 4 months to really keep that improvement going. So I'm every 3 months shooting myself up, girl. Every 3 months.
Come in and let you shoot me up.
You did great, baby. You did great. Any other questions, guys? All right, I'm going to go back and do consults then.